So a little bit about my background. I've been a registered pharmacist for 32 years. My dad was a pharmacist, so I was brought up in this business. I worked with him since I was 12. So there's one thing I know well, and that's pharmacy and medication. My patients trust me. I love my patients. And the goal here is to get all my patients well and to normalize all of their blood pressure. As a pharmacist, I usually see the patients after they've seen the physician. He or she will come to me with a prescription, and then we will discuss the medication and what's going on after that. They learn that their blood pressure is not normal, and they need to normalize it. They come to me and they have a lot of questions. They're more comfortable in that setting, and they have a lot of questions about normalizing blood pressure, and there are a lot of ways that we can go about discussing that. So a physician will tell a patient, who most of the time I know, that their blood pressure is abnormal and they need to normalize it. And the questions that come after that between medication and lifestyle choices can be very detailed. And so what we try to do originally is we'll try very often to have dietary restrictions, lower salt, exercise, just normal everyday things. Here's the kind of questions that I often get. People are very concerned about side effects of medication. What are things that, just dietary things they can do, exercise, just things that we can try to do. People are very surprised when they have high blood pressure because it's an asymptomatic disease, meaning people have no symptoms. So then they come to me and all of a sudden they have high blood pressure. They're concerned about taking medication because they feel fine, and they're concerned that they won't feel fine after they take the medication. They're concerned about side effects, and very often they want to do alternatives if possible. If their doctor agrees to that, then we'll go on a way to do dietary things to normalize their blood pressure, exercise, just things like that. The suggestions that I would normally put to one of my patients is to first reduce salt intake. That's just everyone should know that. Exercise, if you're not a runner, walk. Do just things to get your body active to maybe decrease the pressure. People are concerned about taking medication because blood pressure is an asymptomatic disease, meaning it has no symptoms. You go to the doctor, they say your blood pressure is abnormal, we need to normalize it, and this is how we're going to do it. And they hand them a prescription. Then they come to me, and then they have a million questions about the prescription or other things that they can do to normalize blood pressure. After I fill the prescription, I hand my patient an education pamphlet about the medication. Very often they'll read through it while I'm standing there, and their concerns are written all over their face. They're concerned about side effects. They're concerned about what's going to happen to them because, once again, when your blood pressure is abnormal, it's asymptomatic. You don't know. After the patient has read the education pamphlet, then the questions start. Will I get this side effect? How many people get it? And in most cases, the side effects are rare, and most people don't get them, and they have no effect at all. Very often what I will tell my patients is, let's try it for a week, and if you're not doing well on it, we'll call your physician and we'll switch you to something else. There are choices. We'll often discuss other lifestyle changes they can do to normalize their blood pressure, such as dietary, decrease salt, increase exercise. Very often that will take a few points off of both your diastolic and systolic blood pressure. So very often what we'll go through the medications with my patients. The first line of therapy usually is a diuretic. Some examples of that would be furosemide or hydrochlorothiazide. The issues or the concerns of patients with that is dosing and when to take it. Because if you take it in the morning before you leave for work and you're on a subway or you're in a car, you're going to have to go to the bathroom. So, because the diuretic gets rid of water. The second thing is usually beta blockers. An example of beta blocker would be atenolol, metoprolol, anything with an OL at the end. Those have a lot of side effects, and when patients read through this, it's a concern because the patients will get tired. There's dizziness involved, constipation, stomach issues. With the men, there's sexual side effects, so that's a big issue for a lot of people. What we most often tell our patients is to try it for a week or two, because they probably won't get most of these side effects listed in the education pamphlet. So what we say is try it for a week or two. If you don't like it, we'll go back to the doctor, or we'll try to prescribe something else. Next line of therapy would be an ACE inhibitor, which would be lisinopril, enalapril. The major side effect for those, where you would have to stop taking the medication, is a very bad dry cough, a consistent, persistent cough. As soon as that happens, you have to call the doctor, switch up the medications, and so now we've gone through 3 classes of drugs, all which have side effects. Then there's something called a calcium channel blocker, which would be a diltiazem, but those are not usually first line of therapy, and those have side effects also: sexual, tiredness, headache, dizziness. So when people start to read this, there's a million questions that come after that. And that's where we try to help out and try to list other things that they can do to help normalize their blood pressure. I also tell my patients that most of the time they will not get these side effects. It's a small percentage that's listed in the education pamphlet that I'm giving them, that's given to me by the manufacturer of the drug. But very often it won't happen. And I do tell my patients that all the time. Let's try it for a week, see how you do, give me a call. If it's not working well, we'll go back to the doctor, we'll try to switch it up. Most of my patients' concerns are side effect related. So very often they will ask me if there are other things that they can do other than taking the medication. That's when we suggest different type of lifestyle changes, such as reducing salt, exercise, walking, just everyday things that are just to me make sense. Try that also for a few weeks, because you're going to see your physician probably in another 3 weeks, because he's going to want to test your blood pressure, because it can be dangerous. I also tell my patients that most of the time they will not get these side effects. It's a small percentage that's listed in the education pamphlet that I'm giving them, that's given to me by the manufacturer of the drug. But very often it won't happen. And I do tell my patients that all the time. Let's try it for a week, see how you do, give me a call. If it's not working well, we'll go back to the doctor, we'll try to switch it up. Most of my patients' concerns are side effect related. So very often they will ask me if there are other things that they can do other than taking the medication. That's when we suggest different type of lifestyle changes, such as reducing salt, exercise, walking, just everyday things that are just to me make sense. Try that also for a few weeks, because you're going to see your physician probably in another 3 weeks, because he's going to want to test your blood pressure, because it can be dangerous. The number one reason that patients can't regulate their blood pressure is because they don't comply with the medication because of the side effects. So this is the biggest problem that I see. When a patient gets a 30-day supply of a medication, then they come back to me 6 weeks later, 42 days later, and they still have some tablets in their bottle, I know they're not taking their medication. Having abnormal blood pressure is very dangerous. And I can list a million reasons why you want to normalize your blood pressure. But if you're going to get side effects from a medication, you may not take it. So I try to tell the patients all the time, do it for a few weeks. A lot of the times you won't get the side effect. If you do get a small side effect, chances are after 2 weeks it will be gone. But I do stress all the time, you need to speak to your physician about this, not only to me. The physician has to be a part of this equation. Compliance is one of the biggest problems that we have. People stop taking their medication because they don't feel well on it. And they felt fine before they went to the doctor. They go to the doctor, they find out their blood pressure is abnormal, then they have to take these medications, and then medications make them feel worse. I want to stress that we never, ever tell a patient to stop taking their medication without speaking to their physician. It is always the number one thing they must do. But if they're not feeling well with the medication that the doctor gave them, they need to switch it. And the only person to switch that is the physician. I can help them along the way with the medications that they get and with lifestyle choices, but the physician is the one that changes the medication and is most concerned with their blood pressure. It's extremely important to have your blood pressure taken, but But after you see your physician and get normalized on the medication or a lifestyle change, it's very important to get your blood pressure normalized. Regardless of how you do it, it has to get done. The first month or so, you're going to go back to the physician very often. He's going to take your blood pressure, she's going to take your blood pressure, and we're going to make sure that it's normal. Together, then we can suggest lifestyle changes. But that's only after you've seen the physician and only after we've stabilized your blood pressure. The last piece of advice I would give a patient is always to make sure their blood pressure is under control, to normalize their blood pressure at any cost. Whether it's dietary, medication, it's a very important thing. So to my patients always, I say if it's medication or dietary or a combination, you have to stick with the program because lifestyle changes work, medication works, diet works, and as a team, the physician, the pharmacist, and the patient will all get better. And the most important thing for every patient is to stick with it. They have to take the medicine, they have to be compliant, they have to change their diet, they have to do lifestyle changes, and together they can achieve this goal. But they must stick with the program.